Okay, my name is James Coe with ND3, and today we'd like to welcome Tiffani Bacon, a pediatric physical therapist in North Carolina. Hi, Tiffani.
Hi, James. How are you doing?
I'm doing great, thank you, and I really appreciate you being on this show today. Today we've got a really important topic. We're going to be talking about pediatric ailments and disorders. Tiffani Bacon here is a pediatric physical therapist who specializes in working with kids. And Tiffani, how long have you been working with kids?
I've been working with children with physical therapy concerns for the past 10 years.
And in the past 10 years, it seems like there's been a lot of increase, a higher prevalence of children who are having physical problems, developmental problems, cognitive problems, behavior problems. Is that what you've been seeing?
Yes, I have. I think people are more attuned as to what to look out for. I think there's more educational materials out there via the internet. I think people are more aware and more concerned, and they know what to look, or they're beginning to know what to look out for when it comes to developmental issues and concerns.
What exactly is developmental delay?
Developmental delay is when a child at a certain age, say if they're 1 and they're not walking, then that child would probably be labeled or be considered to be delayed. So developmental delay is where a child just is not reaching their gross and fine motor milestones, and they're not walking at a certain age. They're not talking at a certain age. They're not sitting or rolling at a certain age. So basically they're behind physically in some, or cognitively in some form.
And when a child is experiencing developmental delay, is it important to get some kind of treatment or intervention, or will they kind of grow out of it?
Yes, it is important for the child to get help and to seek a therapist, a trained therapist that is able to work with whatever the issue at hand may be. The sooner the better, because that way we can offset potential habits, we can break bad habits the child might be developing.
What are some of the symptoms that you see with maybe some older kids who might be experiencing developmental delay but never got treatment?
They might be, for instance, walking with what's called a deviated gait pattern. So they might be favoring one side, for instance, or a hip might be turned out a little bit too far as they're walking. Just basically the child might be developing bad habits as they maneuver throughout their home and community. And these habits, the older they get, it would be harder for the parent and maybe even the therapist to break. So the sooner we see a child who fits that pattern, who's not walking in a more functional pattern or a more typical pattern, I should say, the sooner we see a child like that, then we can definitely help. And the outcomes are generally pretty good with our services.
And can these kind of problems or disorders, can they influence or affect a child's confidence or personality?
Absolutely. I think kids, when they're able to do the things that other children are doing, and other children also notice that. So we can help to ensure the children that we see are doing the things that their peers are also doing, so they don't feel left out, so they are able to play and engage with their friends during recess at school, even with their family, so they don't feel left out. No one wants to feel alone, and so we can help to increase the participatory levels of children and engage with their community.
Excellent. Well, what are some of the kids who don't get treatment, let's say early on? How old are some of the kids that you see that still are, experiencing or suffering from these symptoms of developmental delay?
It might be 4 or 5 if we've not seen them, or if no therapist has seen them. And by the time we get to them, the delay might be pretty profound by that time. So the sooner we see them, the better, and we can help offset whatever bad habits or patterns, or just we can help offset that so that the child can function at an optimal level and be happy and confident and have a better quality of life.
What causes developmental delay?
Various situations could cause developmental delay. Sometimes the delay is medical, and the child might have undergone a traumatic birth, or sometimes the child they're not given chances or opportunities to really engage with others, so they may lose out on some of those really important life steps. So that might potentially cause that delay, but we could help to educate parents as to what to look out for so that doesn't happen to their child. The child can grow and flourish and still meet their functional needs.
And what exactly do you do as a pediatric therapist to be a solution to some of these problems?
I instruct the patients as to how to move more optimally, and also educate parents on ways that are help and enable and empower their children to move and maneuver in an efficient way. Through a lot of education, a lot of repetitive motions, I'm able to help the child reach their optimal functional level.
What kind of diagnoses do you typically see in the clinic?
Cerebral palsy, and we see patients who have muscular dystrophy. We see patients with some traumatic brain injuries, Spina Bifida, gross motor and fine motor delays. We see patients with hypotonia, basically low tone, or hypertonia, high tone. We see patients who just have different musculoskeletal and neuromuscular disorders, and we're able to treat them in the clinic with as much support and love and ensure that they are flourishing once they're back out in their community.
And are these therapy treatments, are they effective? Are they somewhat effective, highly effective? What has been your experience?
I would say they're highly effective. I feel that we are really good at what we do, and we are able to make sure that both the parents are satisfied with the progress and the children. They may not like everything that we make them do, but they are sure playing a whole lot more than they were. They're able to engage with their peers more than they had been before. And both the children and the parents, they see that. But I would say we're very, very effective.
How long does it take to start seeing some results?
I would say as early as 2 weeks sometimes. It's not even sooner, depending on the diagnosis. But I would say as late as maybe 4 weeks, you'd really start to see some real changes.
And I would imagine that since they are still developing, that treatment programs usually last a little while, correct? How long do they usually typically last?
It depends on if the child is really involved, and if they are really involved, the program would last up to 6 months. And after that 6-month period, we determine where we are functionally and see if we need to continue treatment. If the child is not involved, if they have a very mild condition, something like Torticollis, which is what we also treat, it might take up to a day.
Now, what can a parent typically expect to pay? What would the cost be?
We are in network with all the major insurance providers, so parents would pay whatever their plan's copay or deductible for whatever plan they have. But we are in network with all of the major insurance providers for North Carolina.
Oh, that's great. That's good news. What about those parents who might not have insurance that suspect that there might be something wrong with their child? Could they pay cash or credit card, or do you have any financial hardship discounts, which a lot of people today are undergoing financial hardship?
Yes, we will definitely work with families who qualify for financial hardship. We definitely want to make sure that we make a difference in every child's life, regardless as to whatever their socioeconomic status would be. But we will work with the individual families and settle on fees that's mutually beneficial and mutually agreed upon among both parties.
Excellent. That's good news as well. Well, is there anything else that you feel parents should know that they may not know about, having a child with special needs?
The sooner they get them into to see a therapist, the better their results. So don't be afraid to call an agency like us, Kinetic Kids. We are extremely good at what we do. That when you bring your child to see us, I think you too will see the difference in your child.
Well, very good. Well, thank you, Tiffani, for being on the show with us today. We really appreciate it. You're welcome, and thank you. For those of you who may have questions or comments, you can definitely go to our website at kinetickidsinc.com. Once again, it's kinetickidsinc.com. Thank you, Tiffani, and we hope to talk with you again.
Okay, thank you so much.